Welcome back to session number 5 of our Flourishing in Medicine series. This session is about conflict. We call it Furious to Curious, managing conflict with patients, colleagues, and staff. And inevitably, conflict is one of those domains which is something that is just part of our life. It's part of our work life in particular. There's not always agreement. There not only is disagreement sometimes, but also difficulty matching people's personalities and working. It's just the nature of working in teams, working in groups, working with patients, working with staffs, working in complex systems and organizations. But it's worth spending some time investigating how these qualities of mindful practice could be applied to this area of conflict. So, our objectives in this session is to really describe our own typical reactions and optimal responses to conflict. So, what are some of the ways in which we habitually react, and what are some of the ways in which we can learn to handle conflict in a more judicious, helpful, and even healthful way. We're also going to practice ways of developing what we call mental stability in the face of conflict. So we develop a little bit of what's called equanimity. So we're not so thrown off that we are unable to proceed and do our work. And that does reduce the emotional labor and the emotional toll that conflict can have on our own well-being. And finally, we're going to show how these qualities of mindful practice, these qualities including attentive observation, critical curiosity, beginner's mind, and presence, can help us deal more effectively with conflict. So before we proceed, I'd like to review the home practice from last session. You remember the befriending practice, and I'd like to actually begin very appropriately with that practice itself. As you recall, this was a practice in which we presented it in the suffering module as a way of helping us deal with those situations which are difficult. And conflictual situations are, by definition, difficult. So in this short guidance which I will lead you, I would like you to bring into mind someone who you have had difficulties with, conflict. Maybe a coworker, a colleague, a patient, a staff member, an administrator, somebody that's brought up an experience of difficulty for you, and you're not sure quite how to do that and how to work with that. And just imagining this person, bringing it into your mind's eye, and knowing that just like me practice, that this person has an agenda and goals and objectives, and probably has some elements of wanting to do the right thing. And even though you don't have to deny that the conflict is there, you don't have to deny that you're having difficulties with this person, seeing if it's possible for you to extend to that person some qualities, some wishes for them to be happy and healthy and safe and have some comfort. So having that person in your mind's eye, if it's helpful you can close your eyes or bring your gaze down, really seeing that person. The really cool thing about this kind of practice is, you don't have to do that right in front of them. You can actually experiment with this and notice your own reactions, and it's pretty safe. So if you would be courageous enough to do that, and maybe saying to yourself as if you're speaking to that person, may you be happy. Certainly, like almost all human beings, they just want to be happy too. May you be healthy. And I like to say as healthy as is possible, because health is really a spectrum. So may you be healthy as possible. I don't really know what you might be holding in your life in terms of health, but I wish that you could be as healthy as possible. And may you move through your moments, through your days, with safety, with a sense of security, that you'll be free from harm. The harm that may come from outside of you, the harm that you may do to yourself by certain behaviors or actions. May you be safe. And may you have ease and comfort. Let's try that one more time. Think of this person, really bringing that person's full being into your presence and saying to them, may you be happy. May you be healthy. May you be safe. And may you have ease. And if you'd like, you could pause this recording and continue that practice for others or for yourself, as we did at the end of last session. Whatever you'd like to do. But as we proceed, I'm going to invite Ron to come in and share with you a little more detail about the ways in which we sometimes habitually deal with conflict, and the ways in which we can be more mindful about our approach to conflict using those qualities that we have talked about in mindful practice.
Well, thanks, Mick. So I'm going to talk a little bit about conflict, and I really like this quote from Jung: everything that irritates us about others can lead us to an understanding of ourselves. And notice he puts the word can lead us to an understanding. It doesn't always, but it requires a little bit of effort and also a little bit of alchemy. And the theme of this session is moving from furious to curious. And that's really, I think, the most important skill that we can develop in this sense, because it's when emotions are running high, we tend to close down. We tend to see the world through only one lens, and we tend not to expand our scope and vision. And the real challenge is to say, yes, I'm angry, this is not working out, I want it to be different, and maybe there's another way to see the situation. So a story, this comes from an article by Rana Awdish, A-W-D-I-S-H. She wrote a great book about her own experience as a patient. She had a very severe, very serious illness and was in an ICU for quite some time, and wrote about that. And subsequently wrote an article that appeared in the Annals of Internal Medicine that's in your reading list, in which she recounts an experience with a patient who came in at the height of the COVID pandemic, when masks were required and vaccines were required for all health professionals, and described this situation where a patient that she had known well and had gone through many difficulties, run as an ICU doc, pulmonologist, and this patient had had cancer and various other complications. So anyway, the patient comes in and immediately rips off her mask and says basically that this is totally ridiculous, that this is a government thing that she doesn't like. Anyway, goes on, and meanwhile Rana has her mask on and feels that her blood is beginning to boil because she's been working in ICUs, taking care of people who were dying of COVID infections, putting herself at tremendous risk, and here's a patient who seems to be almost mocking her efforts. But the interesting thing in that article is that Rana, who incidentally did attend one of our trainings, but she said that psychologically that as her anger was mounting, she realized that she didn't want to be that way. She did not want to be an angry person. She didn't want to be blaming the patient for something. She wanted to try to inhabit her role as a healer. and describes that she was able to find this little space, this little pause that she could take in which she decided where she wanted to throw her weight, just like the quote we had earlier from Ronald, the psychologist. She was able to take a pause, and rather than just reacting out of anger, trying to figure out what it was that she needed to say, and said something to her patient like, I care a lot for you and want to make sure you're safe. And also from what I've seen as a clinician, I'm going to have to keep my mask on. And so that ability to express caring as well as her own needs was part of that alchemy of transforming. And then Rana said, and how has all this been for you? And then the patient then also turned and said, and started talking about how her family has basically excluded her from all events because she's not vaccinated and won't use a mask, how it's felt quite lonely for her. And then their relationship started to get back on a more even keel. A situation that could have exploded and escalated then resulted in some degree of human understanding. It's unclear whether the patient ultimately decided whether to have treatment or to use a mask or to be vaccinated. That didn't matter quite so much as just that this was this little turning point. So I'd invite you to think about situations of conflict, this discord caused by actual or perceived opposition of needs, values, and interests. Thinking about Rana Audish's story, but also thinking about stories that you have in which conflict has been handled well, that's resulted in clarity of communication, creative solutions in difficult situations, a sense of accomplishment, improved care, safety, teaching, energy, and avoiding the breakdowns in communication, lapses in patient safety, poor coordination, fatigue, burnout. So think about situations in which conflict was able to resolve well. So this next idea, it may sound really obvious to you, but how do you recognize when you are actually in conflict, right? So sometimes by not recognizing the early signs of conflict, even a patient looking away, or sometimes even subtle signs like a prescription that should have been refilled months ago hasn't been. So how do you recognize the early phases of conflict when you can begin to do something about it? Okay. So think about, what do you notice? What do you notice in yourself? Okay. Do you feel a sense of disconnection? Do you feel a sense of distancing? A sense that this person is not like you in some way? A failure of empathy? So how do you recognize when you're in conflict? And when you're first aware that you're in conflict, like in your work setting, but you can also think about at home and whatever, what do you feel in your body? Okay, the body doesn't lie. Okay, often we can kind of convince ourselves that things are okay when they're really not, but in your body you begin to feel a certain tension. Maybe your shoulders get maybe in your hands, maybe your heart beats more quickly. But what is it that you first feel when just the beginnings of conflict, when you're first aware? Then what thoughts do you have? Do you have a thought of superiority, like this person is stupid or doesn't know what's good for them, or if they would only do such and such? What emotions do you have? Are you angry, or you feel disconnected? Are you indifferent? Okay, that's a dangerous emotion, right? Indifference, especially when you're in healthcare. And so what's your typical first reaction to conflict? Is it reinforcing that you're right and they're wrong? Kind of a defensive reaction, kind of defending your own worldview? Is it a sense of hopelessness? That, oh, there's nothing I can do to change things. So what is your first, so thinking about this conflictual situation that you might be in, what's your first reaction? And importantly, when do you tend to be first aware that you're reacting in that way, in a way that might not necessarily be helpful? Is it after you say something to the person that you wish you hadn't? Or is that awareness before, and then you can kind of modulate your response in such a way that a relationship is preserved even though you see the world differently? So again, giving yourself some time to reflect on what your initial responses tend to be, okay? Again, this is just, if we were here in person and had a discussion, these are some words that might come up. And then think about, what are your biggest triggers for conflict in the work setting? Does it have to do with people? Does it have to do with certain circumstances? Okay, a particular meeting, or a particular day of the week when you might be pressured. What's the context in which these conflictual situations are triggered? Okay, and again, just give yourself some time to think about in what settings. Think about in the past month when you've had conflictual experiences. How you where they have tended to be. When do they tend to happen? Is it towards the end of the day when you're feeling tired? So, much of this is obvious in concept, but trying to assimilate this awareness into our everyday life is really the challenge. So we all have idiosyncratic triggers and typical reactions. Okay, that's part of being human. We often always consider alternative, more effective ways of responding to conflict after the fact, not in the moment. So how do we find the space so that we can think of those things, I should have done that, I should have said that, so we can do that more proactively. And so some of the exercises we've given you already about taking a pause, the stop practice, the where are my feet practice, those are really designed for situations like this. And often our reactions are automatic, but they don't have to be. We actually do have more choices than we think we do. Being aware of thoughts and feelings in the moment can help you choose among different ways of responding. And I should add to that, bodily sensations. When your body's giving you clues, that can actually be a driver of finding another pathway. In my work in palliative care, they never call me into peaceful situations where the family and the patient and the care team all agree on something. Basically, I'm kind of the conflict service, right? When a patient wants to do something the family doesn't want to, or the patient wants to do something, or the patient can't talk for themselves, but the family want to do something that the healthcare team feels that the patient wouldn't have wants. So these situations are often really fraught. And so for me, sometimes when I have those typical thoughts and feelings, it's just an invitation to slow down rather than speed up, rather than trying to resolve the conflict, just to slow down and be a little bit more in observer mode so that I can find the pause and throw my weight where it really will matter. And this idea of mental stability, of being able to kind of stabilize one's own mind, and I think we're all capable of doing that. It's a skill of being intentionally open, even-keeled, equanimity, a sense of purpose and balance, even when, and especially when under stress. So that's really the target. That's where we're heading with that. So let's just consider some common styles of addressing conflict. There's the avoidance, I lose, you lose kind of approach where you try to avoid the conflict because nothing can be done about it. Accommodation, I lose, you win, because I have to give up what I wanted. I win, you lose, a competitive, because only one can win. Compromise, I win some, you lose some. Collaboration, I win, you win. I'm not saying that, it sounds like the collaboration is kind of the right answer here. It may not be. It may not be. And so if a patient doesn't want to take a particular medication that I think is helpful, maybe they've got a good reason, and maybe I need to change my mind. So it really depends upon the context and the content of the conflict. And also just to be aware of different cycles. And I think the earlier you're aware of the cycle, the sooner and the easier it is to do something to kind of step outside of the cycle. So in this case, these all start with some sense of threat and some unmet need. In the escalation cycle, that leads to frustration and anxiety, anger. Then our communication becomes distorted by emotion. Our desires become demands. We begin to see the world in a monochromatic way and only think about one solution, one exit pathway. Okay. Another common cycle in avoidance, the same unmet needs, the same threats, this time provoking helplessness and fear rather than frustration and anxiety, which then leads to withdrawal and avoidance. Again, communication being distorted, it's inadequate, indirect, unexpressed needs, which then further escalate those unmet needs and threats. So these are cycles that if we can be aware of when they're kind of beginning to cycle, we can kind of decide to step outside of that. And what does stepping outside consist of? Well, think about some conflict that you've had in the past week. It doesn't have to be major. Explore your own reactions as you recall the event, okay? So let's just get concrete about this, okay? What emotions are you feeling now, even recalling it? What thoughts do you have? What do you feel in your body? Are there specific areas of tension or heat? And then, just as you recall that, just say, well, is this a habit? Is this a way I habitually respond to conflict, a one-time event? So just being aware, oh yeah, I'm stepping into something habitual, okay? So that noting your reaction, I think, is always the first step, and just naming it. I'm stepping into this habitual avoidance cycle or escalation cycle or accommodation cycle. So just knowing yourself a little bit better. So what might a mindful response to conflict look like? And maybe as I'm talking, maybe think about a situation in which you actually were able to handle a conflict reasonably well, at least in some aspects, okay? We're not talking about perfection here. We're talking about, one thing that you did that made the situation better than it otherwise might have been. Or if you can't think of something that you did, try to call to mind something that a colleague did or something that you witnessed. This is a book that I think is really useful. It's called Difficult Conversations. I think one of the authors is affiliated with the Harvard Business School. And even though it's written for a general audience, I found it very useful for healthcare settings. And they kind of divide these difficult conversations into three areas. The first is trying to have a discussion about what happened. And of course, our recall of events is always distorted by our own point of view and our own emotions. So the what happened discussion is always more complex than either person or any member of the conflictual situation can actually see. So just accepting the fact that you can never possibly see all aspects of a situation, just even concretely in terms of what happened. The second part has to do with feelings, and you can never know what someone's actually feeling without asking them, right? You can see the manifestations. You can see the manifestations of their emotions, but there needs to be some conversation in which feelings are actually named. Because people will not listen to facts or arguments until they feel that their feelings have been at least expressed, if not understood. And the third part is an identity conversation. And so for us as healthcare professionals, we want to feel knowledgeable. We want to feel that we are giving correct advice. We want to feel skilled. And if someone is contradicting any of those things, we have any of numerous reactions. One is defensive, okay, and saying, yes, I know better. Another is self-doubt. Well, maybe I don't know. Maybe I'm not a good doctor. Maybe I shouldn't be doing this anyway. So the conversation about what happened, the feelings and identity, are all conversations not only with another individual, but also conversations we have with ourselves, okay? So those reflective questions that we talked about earlier, what am I not seeing here? Am I making assumptions that might not be true? Those kinds of questions of kind of perspective taking and developing a beginner's mind are particularly useful here. So what might I not be seeing or seeing clearly? Do I really know what the other person intended? In what ways might we both be contributing to this conflict? Okay, these are hard questions. In what ways are my feelings affecting my perceptions, thoughts, and actions? Can I address those feelings in a healthy way? How is this issue affecting my sense of identity, my sense of competence, my sense of purpose? What's at stake? Have we addressed feelings before we try to solve problems? Okay. So again, these are the first steps in moving from furious to curious. Noticing that there's a conflict, clarifying what the conflict's about, moving from certainty to curiosity, listening with a beginner's mind, separating people from the problem. That is, just because there's a conflict doesn't mean that that person has any less sense of worth. It doesn't mean that I should apply respect, caring, and compassion to that person any less than if it's someone who agrees with me. Moving from but to and this is a really useful filter that we can adopt every time you think that you're saying, every time you're about to say the word but, maybe just take a little pause and say, well, can you substitute the word and there as well? So I know that you're not taking your medicines for diabetes, I might say, and I'd like to help you move forward with your illness management, okay? Beware of appearing superior or condescending and looking for mutually beneficial options. Again, these sound obvious, but if we look at our own behavior, often it doesn't pan out quite that way. So Nick's going to take over at this point and talk about other ways of developing this beginner's mind to help us move from furious to curious.
So thanks, Ron. I think what we'd like to do now is put this into practice, give you some experience with ways in which we can begin to make that shift from furious to curious, begin to bring these qualities of mindful practice, especially beginner's mind, into these conflictual situations. So I'd like you to take a few minutes and bring to mind a difficult situation. Could be something that's in process right now. It could be something that's happened in the past. A situation in which there was conflict, there was a disagreement, there was challenge, and you felt it, you really experienced it. And something that was actually important to you, meaningful to you. We could say it was juicy, it had some substance to it. And probably because you really felt strongly about it, or maybe still feel very strongly about it if it's something that's in process right now. So if you could take a few moments, and really bring that situation to mind. And as you recall the situation, the really interesting things about memory and about bringing things to mind is that it's not just a cognitive experience. The body's involved, emotions occur. It's all coextensive. And as we've been guiding you and working through these programs, we've often had you direct your attention to somatic sensations, to emotional experiences, to cognition. but they're all occurring all the time. It's impossible. I was going to say it's very difficult. It's impossible to separate them. It's a bit artificial, but these are ways in which we can direct our attention. So thinking about thoughts that come up, I can't believe I'm in this situation. This keeps happening to me. I can't believe they think that. I'm right. Think about feelings in terms of emotions. This makes me angry. This is really difficult. It makes me sad that things don't work the way they should. I'm frustrated. And think about body sensations. As Ron mentioned, these are often our early signs that something's going on. It's information. Are my fists clenched? Is my jaw tightening? Am I bringing my shoulders up? Am I feeling that sinking sensation in the pit of my stomach? And also, if you would, now begin to think about what your typical reaction, your reflexive reaction is, especially in the body. When we're facing conflict, it often is a tense experience in the physical, especially in the muscular domain. So you've been thinking about a situation, either present or in the past, in which you were involved in a conflict that really had some potency to it, something you felt very strongly about. As you bring this to mind, you're thinking of thoughts, feelings, sensations. You're noticing how easy it is to fall into some emotional reaction or verbal reaction or some kind of reflex that's almost beyond our control. Now I'd like you to do this next part of the practice. This is an experiment. Describe to yourself the situation as if you are 100% correct. The other person, the other party, the other part of the conflict is completely and fully wrong. If you'd like to take some notes on a piece of paper, write it down. And while you're doing this description, either in your mind or on the paper, noticing what's happening to your cognition, to your thinking, noticing what's happening to your feelings, how you're feeling, noticing the body tension, the body sensations. Maybe it's not tension, maybe there's something else that you're noticing. So you are 100% correct, and just describe the situation from that point of view. We're going to be taking several point of views. You can see where this is going in this contemplative practice, really, is what this is. It's a reflective practice. And having done that, you could pause the recording if you want to spend a little time with that. But if you're ready to move on, I'll move on and assume that if you needed to pause, you have paused and restarted. Now I'd like you to see if you can step in someone else's shoes. Describe the situation as if you're describing it from the other person's viewpoint, and that their viewpoint is 100% correct. So it gives you a chance, without having to admit that they're correct in real life, but through this thought experiment, through this contemplation, to actually stand in their shoes. See if you can see things a little bit differently. This really is a beginner's mind activity, but it allows you to take simultaneously or sequentially and then hold simultaneously two completely different perspectives. Trying to appreciate that perspective of the other person's. Actually, if you'd like to, if you would be courageous enough, try to convince yourself that they're right. And if you need to take some notes. This really does require us to step out of our own fixed, almost immobile sense of righteousness in a way, and engage in this exploration. It really requires all of our beginner's mind What questions might you ask? What are the different ways in which you can see the situation that you're not? And that's the utility of this kind of exercise, is you can see things perhaps just a little bit differently. And again, as you're thinking about this or writing some notes, paying attention to the thoughts, the feelings in your body, sensations in your body, feelings, emotions, as you do this. One thing that could be helpful is to consider what new insights you've developed by taking another person's perspective. Maybe what a wise friend, somebody from the outside looking at this, or a trusted colleague, or someone you have learned from that you really feel an affiliation with might say. So this is part of the home practice. We'd like you to consider doing this perhaps once a day for the next week, taking a few moments of your time and write a brief note to yourself about a conflict that arose. Could be even small. Maybe write a couple words or sentences or phrases about your perspective, trying to do the same from another's perspective, from the other person's perspective. And if you're not sure where to go with it, you can always reflect on what's going on in your mind. What are your thoughts as you're writing that? How are you feeling in that moment? And what are the body sensations? Those are all trustworthy places for you to direct your attention. And then as you reflect on these brief exercises, what are you learning about yourself and how you handle conflict? What are you learning about conflict in general as you do this exercise? So we're going to summarize here what we've been through. Conflict, this, is inevitable. Taking a course like this or engaging in this session and being really studious with it is not going to get rid of conflict. But you knew that already. It gives us a wider palette of ways of working with conflict. You see, mindfulness is not about trying to create a world that's so rosy and perfect that we can live in and walk through. It's really about being grounded in the reality of our experience, which sometimes is difficult, sometimes is joyous, sometimes is beautiful, sometimes is ugly. Allowing us to be there for the moments that we actually have. And the moments that we have in our work is critically important, not only for us, but for our patients. We discussed being aware of the styles of approaching conflict, all the different ways that Ron described that we work with conflict. I think those are useful frameworks to look at the kind of ways we and others handle conflict. And then the kinds of conversations, the what happened, kind of the objective sort of report of what happened, and then how it affected us and others, the feelings conversation. And then what does this mean for me, who I am, or who that other person is, the identity conversation. And then we reviewed how taking this beginner's mind may allow us to expand our ways of dealing with conflict through taking perspective, standing in someone else's shoes. And so next session we will be discussing and exploring errors and bad outcomes in medicine. Oh joy. Well, actually, like conflict, which is inevitable, errors are part of all of our lives, and it's part of work in medicine. And rather than deny them, there are ways in which we can work in healthy ways that actually give us life and energy and further and deepen our commitment to the work that we do, that we're going to explore. So we'd like you to think about this in the time between this session and the next session, to consider errors in a broad sense or in a very specific sense that you've been involved in or seen, and think about how you and others react to errors in medicine. It's difficult. And consider what a helpful response might look like. So, this is the conclusion of our program, this session. We will see you soon for session number 6, where we will explore when things go wrong. And Ron and I look forward to meeting again soon.